Good morning, everyone. In this news article that I'm covering now, the headline in News 24 reads COVID 19 Scientists raise alarm over increased admission rate among children. And the focus is clearly on our kids. And I've said this many times before in my videos that children will be the focus and that this will move from the old, the frail, the people that have comorbidities to children. And the reason why children has to be the focus for this global plan to work. And I will put the link to this article in the description below this video, as well as in the first comment underneath the video. And if you want to join our channel membership, you can click on the join button and become a part of the channel members. And every Thursday at 8 o'clock, we have a live stream. And this Thursday is going to be one for the record books again. So, in the subheadlines for this article, it says health authorities have raised the alarm over increased admission of children under the age of 5 for COVID 19. Children under 5 are the second largest group of hospital admissions. Most admissions are for people aged 60 and above. But if you look at the amount of people, this is where the key lies. So, they will put a headline on an article, but when you see the context, everything starts to make sense. 2 children under the age of 2 have died from COVID 19 in Swane. Okay, now we don't understand the context around that. Was it COVID related? What was the situation? What do they actually call it? We don't know. Epidemiologists are closely monitoring hospital admissions as more children under the age of 5 are being admitted during the new COVID 19 wave, an age group not yet eligible for vaccination. And that is the key here, is that they want to have children down to the age of 5 vaccinated. And this is the main plan, and then eventually down to the age of birth. This is this as researchers are still hard at work studying zero micron, as I call it, or Omicron, the new COVID-19 variant of concern. Dr. Wasila Yassat, a public health specialist at the National Institute for Communicable Diseases, NICD, said on Friday that while the current surge of infection started in the 10 to 29 age groups, positivity rates have increased in all age groups. In Gauteng, Yassat said they are also seeing an increase in children under 5 being admitted to hospital. So it's important for them to make people now feel that the youngest in society are not excluded from what they call COVID 19. We've always seen children not being heavily affected by the COVID 19 pandemic in the past, not having any admission. In the third wave, we saw more admissions in children under 5 and teenagers. At the start of this wave, which they call the fourth wave, we have seen quite a sharp increase across all age groups, particularly the under 5s. Okay, so that's a target group now, under 5s. As expected, the incidence is still lowest in children. However, the incidence in under 5s is the second highest. It is second to those under 60, which means that very few cases have actually been admitted. The NICD COVID 19 hospital surveillance report paints an even more worrying picture. 11% of all admissions in the city of Tshwane from 14th to 27 November were children under the age of 2 years. Next focus point, up to birth. Among the 23 deaths in Tshwane, in the same period, 7 were patients older than 60 and 3 deaths came from those younger than 20. 2 of the under 20 deaths were children aged 2 and younger. Now, they don't tell us the details. Were there comorbidities? Were there any other circumstances? Nothing like that. And we know anyone that tests positive, according to the PCR test for the SARS-CoV-2 virus or whatever variant they're talking about, and then dies, are classified as a COVID 19 death. Yassat said at the beginning of the waves, when hospitals still have a lot of free beds, doctors might admit more patients for observations. GPs are more likely to admit patients who are milder at the start of a new wave. Certainly, we have heard from pediatricians that some of the admissions have been short stays, a day or two. A child with high fever, a child with diarrhea and vomiting. Now, when you tell the whole nation that there's this new variant and everyone is living in fear, people will rush to hospital for almost any change. And this is what is being explained right here. Okay. Dr. Michelle Groom, head of the Division of Public Health Surveillance and Response at the NICD, agreed that more research was needed to understand the trend. It is very early in the wave. We will know more by monitoring this age group in the next few weeks. We just need to highlight surge preparedness to also include pediatric staff and beds. So they're saying that it might be more kids. At this stage, what they are saying, it could just be um, that any child with a normal fever or diarrhea or vomiting, that they are brought to the hospital for those reasons, because the parents are afraid, especially after the announcements have been made. The NICD said another reason for increasing infection might be that younger children are not yet eligible for vaccination, and this will become the key focus in this month. Currently, only people aged 12 and older can get vaccinated. The National Health Department Dr. Department's Dr. Nicholas Crisp said Pfizer might apply early next year, and here's the crux now, for approval to dispense the COVID-19 vaccine to younger children. So this is the whole point of this article. Then they speak about the rage events. Professor Ken Boffard, head of the trauma unit at Millpark Hospital, raised the alarm over the number of young people traveling home from rage events in the Western Cape and KwaZulu-Natal. The rage events, which attracted thousands of matric pupils from across the country, were cancelled this week after a large number of attendees tested positive for COVID-19. And then they speak about how the parents put their kids on flights, even when some of them were already sick or had tested positive or whatever the case may be, and they flew them back home on flights filled with people, and very soon you will have the rage wave happening. And I just want to end off this article. Vaccinations does not give you 100% protection, they say. He encouraged people to get vaccinated against COVID-19, but then I quote him, vaccinations does not give you 100% protection. In terms of what most people have, which is Pfizer, you probably get about 90% protection. I don't know what that means exactly. If you are vaccinated and carrying the infection, you can infect people for up to 3 days. If you are unvaccinated, you can infect people for up to 10 days. Boffard said from this weekend, Millpark will not allow unvaccinated people to visit patients at the hospital. So if you're unvaccinated, you will not be able to visit your friends or family in the hospital. And I quote, if you are not vaccinated, you will not be allowed to visit your loved one. There are 2 reasons for that. We've got a number of unvaccinated patients and we don't want them to be infected. The other problem is that we have a number of unvaccinated nurses. Nurses are short and we don't want unvaccinated nurses being infected by visitors. So he's saying that there are nurses that have not vaccinated themselves and they have unvaccinated patients in the hospitals. So it's clear that there's a couple of things that's being focused on here. The fact that kids, even under the age of 2, cannot be vaccinated, under the age of 5 cannot be vaccinated, under the age of 12 cannot be vaccinated. This is a huge message in this article, and that a vaccination drive needs to start for those age groups, and that Pfizer will apply for that within early next year. So I will keep you updated with regards to that, and obviously once that rollout starts, they might start mandating it in primary school and many other places. Who knows what this government will come up with? Only the future will tell. At this stage, we know that the government is planning mandates throughout many public areas, as well as obviously, as already is the case in many businesses like Sanlam, the Mediclinic groups, etc. And it's going to be interesting to see what happens if Eskom mandates vaccinations. How many people will stay? How many people will leave? Considering the very low vaccination rate within Eskom, which is around 20% at this stage. And if those people get vaccinated, the electricity supply should stay as is, not the best in the world. But if those people should choose to leave because of the mandate, who knows what the future holds. Thank you very much. Till the next video.